cancer is something that we hear almost on a daily basis anymore, and there's been lots of known factors in cancer. Dr. Todd Bell from Texas Tech Health Sciences Center is with us today to talk about something else you're seeing when it comes to cancer in different numbers, right?
Sure. So there's a lot of things that contribute to a person's cancer risk that we can't control. We can't control genetics. Sometimes we even have difficulty controlling some types of exposures. But there's one particular type of exposure that people do have some control over, and I'm actually not talking about smoking,
right,
although that's definitely something that contributes to certain types of cancer. What we've seen is actually that, and we've known this for a long time, is that our cancer risk increases with radiation exposure.
Sure.
Now, you may say, well, I'm not exposed to radiation. Well, it depends on where you're at and what you're doing. So it turns out that in hospitals, routinely, we do CT scans or CAT scans as a way of being able to image the body and be able to find out what's going wrong with somebody or what the problem is. The issue, though, is that those CT scans can actually cause, or contribute at least, to the risk of cancer because those CT scans use radiation.
Right.
Now, there's a recent article that showed in California, for example, that there had been a significant increase in the amount of CT scans done in the past 10 years or so that was really probably unnecessary CT scans. So someone goes to the emergency room, they have a relatively minor injury, there's not really a reason to do a CT scan, but because it makes both the patient and the doctor feel more comfortable, they end up getting a CT scan done. Now the problem is, if we looked at some old data, like back in 2007, for example, there was about 72 million CT scans done in the U.S., that would probably be almost 30,000 excess cancers that are going to happen just from the CT scans that were done in 2007. If we see this increase in unnecessary CT scans being done, then that's going to be an additional contributor to people's cancer risk. So the take-home point, I think, is that CT scans definitely have a role. There's definitely times that we need to be doing them, but if it's not necessary, then it's probably not worth the risk.
I'm one of those moms that goes, yeah, let's just do it just in case. And so that's the outcome.
Yeah, you know, there's really nothing that we do in life that doesn't have some risk to it. And it's just, I think, worthwhile to be aware of what those risks are.
Okay, good to know. Thank you so much. Again, if you have any questions about this and maybe you think the right route to take is the CAT scan, that you know may not be the best idea, check with your doctor. And if you need more information on this topic, head to our website, newschannel10.com. Thanks, Dr. Bell.